welcome to our course. Today's topic is Pharmaceutical Semi-Solid Dosage Form, which is our chapter number 6. Here we study about semi-solid dosage form, its advantage and disadvantage, what are ideal properties of semi-solids and how they prepare and its formulation. So let's begin with chapter number 6, Pharmaceutical Semi-Solid Dosage Form.
Now come to the chapter number 6, semi-solid dosage form. Semi-solid dosage form preparations are neither solid nor liquid formulation. They are dermatological preparations intended to apply externally on the skin to produce local or systemic effect. Semi-solids adhere to the application surface for sufficiently long period before they are washed off. This properly helps prolong drug delivery at the application site. A semi-solid dosage form is advantageous in terms of its easily application, rapid formulation, and ability to topically deliver a wide variety of drug substances. So they contain one or more active ingredient dissolve or uniformly disperse in a suitable base and any suitable excipients such as emulsifiers, viscosity increasing agent, antimicrobial agent, antioxidant or stabilizers, etc. Dosage form included ointment, paste, cream, plasters, gel or rigid form. So, semi-solids are the topical dosage form used for the therapeutic, protective, cosmetic action. They may be applied to the skin or usually nasally, vaginally or rectally. Advantages of semi-solid dosage form: it is used externally, probability of side effects can be reduced. First pass metabolism or hepatic metabolism is avoided. Local action and site-specific action of drug on local area is achieved. Convenient to non-conscious patient, elderly patient or kids which are not taken dosage form orally or by parenteral route. Suitable dosage form for bitter drugs and more stable than liquid dosage form. Some disadvantage of semi-solid dosage form: there is no dosage accuracy in this type of dosage form. The base which is used in semi-solid dosage form can be easily oxidized. They may cause staining into the clothes or skin. They are bulky to handle comparative to other dosage form. Application with finger may cause contamination. Chemically less stable than solid dosage form and may cause irritation or allergy to some patient. Ideal properties of semi-solids. Semi-solids should be smooth in texture and elegant in appearance, non-dehydrating and non-gritty, non-greasy and non-staining, non-hygroscopic and non-irritating, do not alter membrane or skin function, and miscible with skin secretions. Ideal properties of semi-solids. Physiological properties: they must be or they should be non-irritating to the skin, do not alter membrane or skin functioning, miscible with skin secretions, have low sensitization index. Application properties: easy to applicable with efficient drug release and high aqueous wash ability. Preparation of semi-solid dosage form. A well-prepared semi-solid dosage form should be uniform throughout. It contains no lumps of separated high melting point ingredients of base, free from grittiness, and these are ingredients which are used to prepare semi-solid dosage form. Number 1, base, preservatives, humectant, antioxidant, emulsifiers, gelling agent, permeation enhancers, and buffers. At first, come to the bases. It is one of the most important ingredients used in the formulation of semi-solid dosage form. Ointment bases do not merely act as the carrier of medicament, but they also control the extent of absorption of medicament incorporated in them. The base should be compatible with skin, smooth, non-irritating, non-sanitizing, inert, capable of absorbing water or other liquid preparation, and of releasing the incorporated medicament readily. These are the ideal properties of a basis. They should be inert, non-irritating, and non-sensitizing, compatible with skin pH and drug, good solvent or emulsifying agent for drug, having emollient, protective, non-greasy, and easily removal, release medicament readily at the site of application, and they are pharmaceutically elegant and possesses good stability. Selection of bases depend on the following points: desirable release rate of drug substances from the base, rate and extent of topical drug absorption, desirability to exclusion of moisture from skin, stability of drug in ointment base, and easy removal of base on washing. So bases may be classified in several ways, but the following classification is based on composition is generally used, which are as follow: hydrocarbon bases, absorption bases, water removal bases, water soluble bases, oleogenous bases. So at first, hydrocarbon bases, also known as oleogenous bases. These bases generally consist of a combination of more than one oleogenous material, such as water insoluble hydrophobic oils and fat. Most of the early ointment bases used were oleogenous in nature, but nowadays material obtained from plants, animal, minerals, as well as synthetic origin is employed as oleogenous ointment bases. Combination of these are essentially anhydrous system composed of hydrophobic ingredients. They are called as emulsifying bases because they initially contain no water but are capable of taking it up to yield water in oil and oil in water emulsions. Absorption bases are water in oil type emulsion and have capacity to absorb considerable quantities of water or aqueous solution without marked changes in consistency. Absorption bases are mostly mixture of animal sterols and petrolatum. Combination of cholesterol and other suitable lanolin fractions with white petrolatum are available under different commercial names. Examples are lanolin, aquaphor, etc. Next, emulsion bases or water removal bases. According to the type of emulsion, these bases are classified as water in oil and oil in water emulsion. All water in oil emulsion are not water washable as the oil is in the external phase, and oil in water emulsions are used in dermatological preparation and cosmetic creams. Some of the popular creams include cold cream, vanishing cream, skin creams, emollient creams, etc. Next, water soluble bases. These include both anhydrous and hydrous dermatological non-emulsion bases, which are water soluble and contain no oil phase. These are generally based on either polyethylene glycols or more of other hydrocolloids. Now, antioxidants. Oxygen is a highly reactive atom that is capable of being part of potentially damaging molecules commonly called free radicals. Free radicals are capable of attacking the healthy cells of body, causing them to lose their structure and function. To prevent this, antioxidants are added. Or an antioxidant is a molecule that inhibits the oxidation of other molecules. Oxidation is a chemical reaction that transfers electron or hydrogen from substances to an oxidizing agent. Oxidation reactions can produce free radicals. In turn, these radicals can start chain reaction. Antioxidants terminate these chain reactions by removing free radicals, intermediates, and inhibit other oxidation reactions. They do this by being oxidized themselves. Antioxidants are often reducing. Example of commonly used antioxidants includes butylated hydroxyanisole, butylated hydroxytoluene. Next, permission enhancer. As name indicate, they increase the permeation of drug into the skin. Skin can act as barrier and prevent deep penetration of drug molecules. With the introduction of various penetration enhancers, systemic drug delivery through the transdermal route has gained major importance. Most semi so permeation enhancer are agents which are used to enhance the permeation of drug into the skin. So example is oleic acid. Emulsifier is a substances that stabilize an emulsion by increasing its kinetic stability. Must reduce surface tension for proper emulsification. Ability to increase the viscosity at low concentration. The ideal properties of an emulsifier include must reduce surface tension, prevent coagulation, and get quickly absorbed around the dispersed phase, ability to increase the viscosity at low concentration, and effective at low concentration. These are the example of emulsifying agents: sodium lauryl sulfate, which produce oil in water emulsion, sodium stearic and calcium stearate, glycerol monoestrate, which produce weak water in oil emulsifying agent and use as stabilizing agent and emollient for oil in water emulsion. Next, humectant. Humectant are substances which reduce the loss of moisture. So, a humectant is a hygroscopic substances and used to increase the solubility of active ingredient to elevate the skin penetration and elevate the hydration of skin. Next is buffer. Buffers are added to various purposes such as compatibility with skin, drug solubility, for drug stability, influence ionization of drug, skin due to its weak acidic nature, and tolerates weak acidic preparations. antimicrobial, or you can say preservative. So preservatives are agents which are used to inhibit the growth of microorganisms in the formulation. So to inhibit the growth of contamination of contaminating microorganisms, we required a chemical to preserve a formulation which is called preservative. Examples are para-hydroxybenzoate, phenols, benzoic acid, sorbic acid, etc. Thanks. So this is all about semi-solid dosage form.
So my dear viewers, hope you all know and understand why semi-solids are important and what types of ingredients are used to make them. So this is all about semi-solid. Soon we will be back in continuation of semi-solid dosage form with ointment, our chapter number 7. Till then, enjoy, take care and keep learning. Thank you.